Hello students. Now we're going to go through the medical assessment and how it should be done. This is something you'll want to practice along with me as well. For that you'll need, the only props you're going to need are something to talk to, like I've got my little bear friend here who's going to fill in for my patient today. And what's also allowed in this station is a blank piece of paper. If you have a blank piece of paper with you, you need to show it to the preceptor when you go in and take your exam. They will examine it to make sure it is in fact blank, and they'll give it back to you. You're going to want to write information down on here so that you can relay that when you get to the end of the station and do a report. Like the trauma assessment, the order of the assessment doesn't change. What changes is the information that you find out. And that information may take you in a different direction while you're doing your medical exam, but for the most part, you're going to follow this format every time that you do this medical assessment. Now, the medical assessment and the trauma assessment are identical for the scene safety and the initial exam. Where they change is in the secondary exam and in the reassessment at the end. So you should get your sheet out of your folder for medical assessment, and you need to get yourself a little friend too here, and we'll run through this together. You can pause this and go get those things that you need, and then we're going to start right up. Okay, for the medical assessment, they will read you a scenario. For today's assessment, I'm going to use chest pain as the scenario, and then we will go from there. The first thing we always do once we start and examining a patient is BSI. So my BSIs are on. And cinch. Is my scene safe? Is this an injury or an illness? How many patients do I have? I would consider C-spine, although I probably won't do it on a chest pain patient. And it is going to be chest pain, so I need ALS en route. Now I'm going to go to my good-looking couples always buy cars together because it's always the same. My general impression of my patient is I've got a stuffed bear sitting in front of me. His eyes are open. He watches me as I come into the room. He looks like he has distress on his face. So that's my general impression. Level of consciousness, I would find out the L, level of consciousness, by asking the patient his name, and his name is Mr. Bear, and how old is he, and he's, let's make him 37. He is a male. And I find out that he is in fact alert and oriented to person, time, and place. So he is a alert-oriented patient. He would have a Glasgow Coma scale of 15. Now I want to know what his chief complaint is. Mr. Bear, why did you call us here today? He tells me he's having chest pain. So I'm going to write that down as his chief complaint. And now I need to go on and do my ABCs. His airway is patent. I know that because he's talking to me. So next thing I want to know is his breathing rate. What's his rate and depth of his breathing? At this point, I would give him oxygen. I would probably give him, with chest pain, 15 liters through a non-rebreather. And then I'm going to go on to circulation. I'm going to check Mr. Bear's pulse. I want to know his pulse rate and depth and regularity. I would look and I'd ask the question, is there any major bleeding? Which there is not. And at this point, I'd look at skin color, condition, and temperature as well, and look if he appears shocky at all. Once I've done that evaluation, then I'm going to make him a high priority transport patient because he is having chest pain. Now I go on to my secondary exam, and for that I actually write the letters OPQ, RST right on this paper and sample. I'll begin by asking my partner to get me a set of vital signs. I want pulse, respiration, and blood pressure on this patient, and then I'm going to interview the patient. So, Mr. Bear, did this chest pain you have come on suddenly, or was it gradual? He tells me sudden. I write that down. Does anything make your chest pain better or worse? He tells me the oxygen is helping. Mr. Bear, describe the quality of your pain. Is it burning, pressure? Is it sharp? He tells me it's sharp. Mr. Bear, does your pain go anywhere or does it stay in your chest? He tells me that it goes up the left side of his neck. Severity. On a scale of 1 to 10, Mr. Bear, and 1 is no pain and 10 is the worst pain you ever had, How would you rate this pain? Well, he's a Mr. Bear, so that means he's going to give it a 10 out of 10. And then I'm going to ask him, what time did this start? He tells me about 20 minutes ago. Now, for signs and symptoms, I can see that he's in distress and he's clutching at his chest. His symptoms are he just relayed to me what he feels. Mr. Bear, are you allergic to any medicines? He tells me penicillin. What kind of medicines do you take? He takes nitro tabs, he takes atenolol. And I ask him then, what are your medical problems, Mr. Bear? And he tells me that he has something called angina. And I ask him, okay, is that it? Or do you have something else? And he goes, oh, I also have high blood pressure, which is confirmed by the medications that he's taking. Do you have anything else? And do you have any other medicines you take? And Mr. Bear says that he does not. I'll ask him, when was the last time you ate anything? So I have his last oral intake. And he replies that he had pizza for dinner at 6 o'clock. And then I'll ask him, Mr. Bear, what were you doing when your pain started? And he tells me that he was washing the dishes. Now I've done my OPQRST and sample interview on the patient. I'm going to go on and I'm going to focus on the patient some more. The patient has chest pain, so I'm going to focus on his chest. I would expose the patient's chest so that I could inspect it. I would also palpate his chest. I would also auscultate his chest. It would be within my scope of practice as a basic EMT on a call like this to apply a 4-lead monitor if I have AOS en route, and run a 12-lead if I have AOS en route. I can also use my pulse oximeter. I could also test the patient's blood glucose. All of those things, check head to toe and see if he has any other complaints. And that's my secondary exam. Now, once I've done that, I have to state what interventions I would do. Well, I've given the patient oxygen, but since he takes nitro, I would like to give him nitro. I can tell you that 2 indications for nitro are chest pain and a patient whose blood pressure systolic is above 100, and I can give you 2 contraindications, which would be that the medication does not belong to the patient, it's not prescribed to them, or that they're on an erectile dysfunction medication, or that the medication is expired. Now I can tell you the action of the drug is causing vasodilation to allow more blood to flow. The standard dose is 0.4 milligrams per tablet. The route that medication is given is sublingually under the tongue, and that some side effects I might expect from this medication are headache and a decrease in blood pressure. Now that I know my medication, medical control allows me to give it to the patient. So I have him lift his tongue and say the word la, and when his tongue goes up to go, I stick the tablet underneath his tongue and let it dissolve underneath his tongue. So I've given him interventions, and my field impression is that I have a 37-year-old bear with chest pain, sharp chest pain. That's something nobody can deny and argue with. Now, on the way into the hospital, I will reassess my patient. I'm going to repeat the initial exam, repeat the secondary exam, and repeat vital signs on the patient. And then I'm going to do a call into the hospital. So when I call into the hospital, I want to have already in order what I have done to the patient and all the information they need to know so that I can give them information. Now, I asked my partner to get vital signs, and now he reports to me that the patient's pulse is 110, that the patient's respiratory rate is 20, and that the patient's blood pressure is 150 over 90. I also did a pulse oximetry on the patient and found out that while he's on oxygen, he's got a 97% sat. His blood glucose is 123. So with that information, I now call in the hospital. So I take my phone out. I call into the hospital and say, yes, Anies, this is Medic 1. I'm en route to your facility with a 37-year-old bear. He has chest pain. It came on suddenly. He reports the oxygen we're giving him is helping him. It's sharp. It's non-radiating, or radiates up his left side of his neck, and it is steady pain. He gives it a 10 out of 10. It's been going on for about 20 minutes. The patient is allergic to penicillin, takes nitro and atenolol. He has a history of angina and hypertension. Last time he ate was 6 o'clock, and this came on when he was washing dishes. At this point, I've given the patient oxygen, 15 liters through a non-rebreather. The patient's had 1 nitro. The patient has not yet reported any relief. Vital signs are as follows: pulse rate 110, respiration rate is 20, his blood pressure is 150/90, he is 97% on the 15 liters of O2, and his blood sugar is 123. Our ETA to your facility will be about 10 minutes. Do you have any questions or orders? The hospital says they do not, at which time now my report is over and your medical assessment is over. Chest pain is just one of the scenarios you may get in a medical assessment. Shortness of breath is another one. You may have altered mental status. You may have anything that will prompt you to use the medications we've gone over in class. So that's one of the reasons you need to know your medications really well. So I suggest you practice that along with your imaginary friend or a nice stuffed animal, so that you get better at doing these assessments. Again, the order doesn't change. The information that you get will change, and as we go through the medical chapters, we'll find more and more complications that may be added to this scenario. But you're going to have to react to each one of those as you find out the information, deal with the problem that you have, and then go back to where you left off in your assessment. So you want to know this framework really, really well. I hope you guys find this helpful. Let me know what you think, and I'll be seeing you soon. Say bye, Mr. Bear.